Hi, and welcome to Upgraded Biology. My name is Dr. Tammy Moralia, and I'm your host. Upgraded Biology is the outcome of 20 years of practicing functional medicine and specializing in hormones. This podcast is where we will present all the information and tools I've learned and continue to learn on how to harmonize and optimize all aspects of your health. Hello, everybody. I hope you're having a beautiful day. I'm super excited to have my friend and colleague, Dr. Isabel Perez, with us. Now, I'm going to read you her bio, so excuse me while I'm looking down because she is a rock star. She is an integrative dentist, and don't worry, you're going to learn what that is, with more than 2 decades of experience. She learned that she could provide her patients with a better healing experience through a biological approach than what was possible with traditional dentistry. She holds a degree in integrative medicine, is a qualified practitioner of emotion and body code, and a diligent biological and dental decoding student. She is captivated by the extraordinary linkages between stress, emotions, and the immunological dysfunction, especially autoimmune. Dr. Isabella designed Biodental Health as a resource to help people decode and understand what their biology and mouth are trying to tell them. And it's a lot. You're going to find out today. She is also the co-founder of the organization Izamizu. Did I say that right?
Yes.
Her purpose is to increase awareness of health and well-being through the integrative approach that combines science, traditional knowledge, and technology, starting at the mouth. Welcome.
Thank you so much. Thank you for having me.
So, what the heck is a biologic dentist? Let's just cut to it. What is that? I know, people have heard of naturopaths. I don't think as many people understand or even know that there's a naturopathic integrative dentistry field. So what is a biologic dentist?
Yeah, it's a good question, and everybody's asking me the same thing because I was a conventional dentist for many years, but I started seeing that my patients were having some lesions in their mouth that I was not able to help them with my knowledge, with what I've learned in dental school. So I decided there is something that is missing. Traditional, conventional dentistry has something that is missing in it. And this is what biological dentistry came into my life because they understand that the mouth is the gateway to the rest of the body. And then science actually has demonstrated that what happens in the mouth affects the rest of the body, and what happens in the body has an impact in the mouth. So I can see in my patients, for example, if they have hormonal imbalances, if they have digestive issues, if they have difficulties breathing, for example, or sleeping. So there's a lot of things that through the mouth, through the teeth, we can see that there is an imbalance in the rest of the body. So when we think about biological, that term means the existence of life. So a biological dentist is going to be using things that will support our biology, support our life, and then will minimize the invasive treatments, minimize the materials that are not compatible with our biology. So then we use a lot of materials that are going to be okay for the body, but we do a lot of testing for that, for us to know exactly what's happening, what will be affecting the body of this specific patient. Because that's another thing that biological dentistry does is we treat everybody as an individual and we don't treat everybody equally because we all have different needs and we all respond in a different way. So for example, we do a biocompatibility test, and this is going to tell us exactly which materials are safe for the body to use and which ones they'll be causing a high reactivity in the body.
Well, that makes sense. I would say that not every medicine is the right medicine for every person. For example, penicillin saves most people's lives from a potentially life-threatening infection if it was to be left untreated. But penicillin can actually kill some people pretty quickly with an anaphylaxis allergic reaction. So I never really thought about it. But if you're putting in a material, your body is going to live with this material forever. It does make sense to see if your body is going to produce a reaction and an inflammatory response to it. Gosh, I hadn't even thought of that.
Yeah.
Ooh.
Yeah, I know. And a lot of,
It's like, oh, what's in my mouth?
no, and the thing is that you're swallowing 1,000 times a day. So
Oh,
if
yeah, I
you
guess you're
have,
swallowing bits of it.
correct. Yes.
Oh,
Yes.
yikes.
So that's something that we kind of concentrate on. Just make sure that what we're using is compatible with the biology of the patient. And then a lot of people think, okay, do I have to do something different to go to a biological dentist? Do they have a different training? And actually, we can find biological dentists or general dentists. We can find orthodontics. We can find oral surgeons that are biological as well. What the difference is that we have extra training in dental toxicology. We can have a lot of training from traditional Chinese medicine, Ayurveda, homeopathic medicine, energy medicine. So there is more things that we have learned to be able to have that connection between the body and the mouth and understand that connection.
Well, let's talk about a few of these connections. I just finished reading an amazing book called Breath by Nestor. What a great book. It's an older book. I don't know why I hadn't run across it yet. But in it, he's talking about how our teeth were actually perfect and aligned, and everything was spaced apart perfectly. And then we started messing with that, and we started pushing the teeth back and shrinking the palate for aesthetic reasons. And it all started, in his opinion and his research, from when we stopped chewing, when we started eating soft food and cooked food, which of course was going to happen as time progressed on, but it did change our teeth, and then our teeth changed our nasal cavity and our sinuses and our ability to produce nitric oxide, which affects your cardiovascular system and your blood pressure and your heart. And oh my gosh, it's this rabbit hole just from your teeth.
I know. It is amazing.
So what is it about your teeth and your mouth and breath? You are responsible for my wonderful, delicious, sleep-filled nights. And let me explain this. So we went out for dinner, and my husband snores terribly. Like, you can hear him downstairs. And you had suggested that we try taping his mouth shut, and both he and I were just like, that sounds terrible, we're gonna suffocate. Now I was gonna try it with him. Oh my gosh, snoring done. It's a miracle. So what is it about your mouth and your teeth that affect breath?
Well, the thing is it's just the position. One of the most important things that we do when we are treating a patient is we need to have all the pieces of the puzzle. It's like our body, our health is a puzzle. And that's why when you go to some doctors, they get some of the tests, some lab work, but then they're missing some of those pieces to complete that picture. So when we do see a patient, we take a CBCT, a 3D image of the patient. One of the things that we see on this CBCT is the position of the tongue. When your tongue is positioned in the right place, your airway is going to have a little more space so you can breathe properly. If your tongue is low, and then if you're laying down, if you just imagine, the gravity is going to pull that tongue back. So it's going to reduce the airway. So one of the things that we check is, okay, how is the posture of the tongue? And how big is that airway? One of the causes of sleep apnea is because there is a limited airway. And it can be associated to not only the position of the tongue, but is also associated to, for example, the cervical area. So there is 1 billion people worldwide that stop breathing while they sleep, and they don't know it. So
And
we,
there's some pretty significant health risks that become evident pretty quickly in people, but they're not always felt. You know, there's hypertension, high blood pressure can sometimes be the root cause, can be sleep apnea. But I know that the vast majority of doctors who, when their patient has high blood pressure, they just put them on an antihypertensive medication. They don't dive into a sleep study and find out what's going on.
that's true. That is true. So then what you were asking, what's the benefit or what is it, what's the relationship between breathing and the teeth? So let's say if you are a mouth breather, if you're sleeping and your mouth is open, then your mouth is going to get drier. Bacteria is going to stick to your teeth more because things stick to surfaces that are not wet easily than if they're dry. So if your mouth is dry, you're going to have more bacteria sticking to your teeth, and it's usually around the gums. So we're going to have more inflammation in our gums. And then when we are, for example, taping the mouth, what you're doing is you are closing the lips very gentle, and a lot of people get scared about, I don't know if I can sleep with my mouth taped.
I know, we freaked out, but it works. I swear to you, go. You don't suffocate.
It is just amazing because you're not only reducing that dryness in your mouth, but you're also increasing that nitric oxide. It has a lot of benefits. The majority of my patients, when they start doing the mouth taping, they notice a huge change in fatigue. So they feel more energetic. They have more energy. They're able to sleep better. But then a lot less inflammation. And kids are one of the ones that we should be really looking into because they do have the tendency to sleep with their mouth open, usually because there is a deficiency in space in their mouth. So the tongue has a tendency to go back, reducing that airway. So what they do, they need to breathe, they open their mouth. And then it causes a lot of other changes because they're growing, their structure, the mandible, their maxilla is growing. So if you don't have the proper tongue position, because the tongue is going to help us grow those structures in the right way. So if the tongue is down or is back, so the maxilla is going to collapse. So you're going to see a lot of those kids, they have a long face, they have open mouth, really red gums because there is inflammation in their gums. And there is different things that the parents and the dentist can do to prevent that because it will turn into bigger problems when they become adults. So breathing is critical, but tongue positioning and space is really important for a dentist to be able to identify this really early in life. And as an adult, you can also do things to change it.
Yeah, that's the one thing that I was fascinated that actually your mouth is this structure, even the bony structure, it's not set actually. It can be malleable for your whole life. Like you really aren't going to change, you know, the structure of your arm bones or even your hand bones. But your facial structures are malleable, and just by breathing differently, by taping your mouth, you can actually change your sinuses and open up things and change your palate and all kinds of things quite quickly too. I was surprised.
Yes, there is an exercise that we recommend a lot of our patients that have like the tone of their tongue is not as strong. And there is a doctor that created this technique is mewing. So that people can go and research about it, mewing exercises where they are teaching you where to position the tongue, how to swallow, and actually the facial structure changes significantly in adults. It's just
Wow.
incredible. One of the things,
How do you mew?
how do you mute? So
Yeah, like you're not talking about meow.
no, and this is something that I encourage everybody to go and look at it because there's a lot of videos that can teach you how with images because it's a lot easier to see the
Oh,
image.
okay.
And then the idea is the tongue at every moment, except when you're eating, should be resting in the roof of your mouth. all the time. So we need,
Wow.
that's the resting position of the tongue. So if your tongue is not resting in there, you're not having a good position. And it's very
I
easy
think
to
the
diagnose it on the CBCT. You see a huge
Okay.
radiolucency, a space between the palate and the tongue. It's like,
So how do you spell Mew?
Meow.
Oh, like the cat.
Yes.
Okay. So,
Mm-hmm.
okay, we'll see if we can get a link to that exercise in the show notes here for you, everyone, so you can learn how to mew. The other interesting fact I learned about the mouth and the teeth is that our teeth shouldn't touch when we're relaxed. The only time that your teeth are supposed to touch is when you're chewing. And I was like, oh,
Yes.
that's not the case for me. I'm like gripping and grinding and like, uh oh.
Imagine if, for example, I'm touching you, or if I'm touching myself on my arm with my finger. Maybe it doesn't bother me at first, but if you do that multiple times a day, multiple days, weeks, months, what's going to happen in there?
Grand Canyon, one drop of water.
Exactly. So imagine that in your mouth. If you are just resting your teeth, so one of the mantras that I recommend my patients is lips together, teeth apart. That's something that you should remember all the time, lips together, teeth apart. Because if your teeth are touching, you're going to cause some wear on the surface of the teeth. You're going to cause an increased recession because it's trauma for the tooth. So the bone is like, okay, what's happening here? I need to defend. So it goes away. Kind of, you lose some bone and the gum follows it. So there is some recession and there's fracture lines as well. So you can see some little crack lines. And and that's if barely touching multiple times. But if you're squeezing, if you're clenching, then it's multiply that by the pressure that you're applying on your teeth.
So, this might be a controversial subject then, but I've always wondered about the people that are, teeth grinders at night and then their regular dentists give them a mouth guard and I'm like, isn't that giving you something to chew on and bite on all night long so you for sure do it? Like, how is this helpful? Or am I just completely off track on the wrong side?
I love the question. It's an amazing question and it has multiple answers. So when I was when you're trained in dental school, they tell you, yes, every patient that has bruxism, that's what is called clenching and grinding, needs a mouth guard. They didn't tell us it has to be an upper, it has to be a lower. It's like, and then for many years, and now that I know a little bit more about the effect in the body, is like, oh my goodness, okay. So as you were saying, the bones and everything in the mouth changes. We have the sutures in our skull. A lot of people think that those sutures are set and they're not moving, and that's not true. So they do a minimum, and this is microscopic flexing. When you have a mouth guard that is on the upper teeth, you're limiting that movement of the sutures. And this is something I learned with the craniofacial chiropractor. So what we recommend is a lowered niger because the
Okay.
mandible doesn't have any sutures in it. But if, as we were talking about it, we need to have an individualized approach because if this patient is having a sleep apnea, has a very narrow arch, and you put something else in your mouth, the
It's
space
even worse.
is going to get worse. Actually, we do a sleep study in our patients, and we had a patient that she was wearing a mouth guard, and she did one night without anything in her mouth, one night with the night guard, and then one night taping her mouth. The results were incredible. So without anything, she had a sleep apnea. She had a medium, like a moderate level of sleep apnea. With her Niger, that level went 4 times higher.
Wow.
With the tape, it was below. So she didn't even qualify as a sleep apnea patient with the tape.
I tell you, if there's a fire in my house, I used to say that I would grab my progesterone and my children in that order, and my husband could run for himself. Well, I have added my mouth tape to this list to run and grab before I leave. It's crazy. I challenge everyone listening. And you don't want to just like grab some scotch tape or some duct tape, some porous tape, paper tape. You can find a million of them online. We have a link for you. We'll put in the show notes here for one on Amazon because I have tried a lot of them. And some of them come off in the middle of the night. Some of them you can't get off in the morning. Some of them are leave goo on, like, ugh. So I've tried a few.
Yes.
But you do want to try it. I double dog dare you all. You will find, and if you are using an Oura Ring or some kind of a sleep tracker, this is your chance to be the CEO, gather data, be evidence-based, be a scientist, and see what happens. Don't just go by what we're saying. Find out if the facts are true in your life, because you want to prove it for you. Just because it happens for most people, it might not happen for you, but try it. Okay, so that was the mouth taping. I love it. And the breath.
Yes.
There's also other health associations with the mouth and teeth. What are some of the more common things that we wouldn't think of necessarily that are associated with our overall health? And our traditional regular doctors are not looking into the mouth, but it's a huge association.
Well, there's many, but one of the things that we really look for is how is the microbiome in your mouth functioning? What's happening in there? And then when you go to a traditional dentist, they just say, oh, yes, you have some plaque, there is some buildup, let's remove that. But we, as biological dentists and integrative dentists, we look for the root cause of the problem. What's happening other than it is poor oral hygiene? Because we have a lot of patients that they brush their teeth really good. They go to their checkups every 6 months, but they still have some inflammation in their gums. Their gums still bleed. And bleeding gums are not normal. I've heard so many times from patients saying, oh, yes, that's normal for me. It's like, no, it is not normal. The gums are not supposed to be bleeding. There is some,
It might be common, but it's not normal.
yes, correct. Because unfortunately, 47% of adults in the United States have periodontal disease.
Oh, wow. And so what can that lead to?
Exactly. So then the problem is that when we go and look in the microscope, we put a little sample of your plaque, put it under the microscope, and we can see the activity of this bacteria. So there's bacteria that is normal. We normally have bacteria everywhere in our body. We need to be live with them, but we need to calm down those more aggressive bacteria, because we can find spirochetes that are very, very aggressive, and we can see in the sample under the microscope how they start attacking the white blood cells, the red blood cells, and we found amoeba in the plaque of the
Ew.
mouth.
Yeah.
That is not supposed to be in the mouth. So when we see this kind of activity, then we understand that there is something systemic going on. And fortunately, all this bacteria can travel in our blood system. There is a lot of linkage between cardiovascular disease and periodontal disease, Alzheimer's disease, dementia, diabetes. There is a huge correlation with systemic conditions that are suppressing that immune system, and they're just showing up as signs and symptoms in the mouth.
Wow. I
Hormonal
know that.
imbalances too.
What was that?
Hormonal imbalances. So a lot of
Really?
the female patients that we have, they say, "Oh, my tongue is burning, and it's really, really dry." That burning tongue a lot of times is associated with some hormonal imbalances. Dry mouth is another one. Dry mouth is not normal. There is an imbalance in the body that is causing this dry mouth. And as we talked about, if the mouth is dry, there is more chances of cavities, more chances of inflammation, then periodontal disease, and then we have a snowball effect that it goes to the systemic.
Wow. So, what would be your recommended daily care for taking care of one's teeth? I mean, a biologic dentist, it would be great. You're in the Seattle area. If people want to come see you, they can, but our listeners are all over the United States, Canada, Australia, Europe. So what can people do in their own life right now? What is your recommendation for things that they can do? Maybe your top 3 tips. Toothpaste, all these different things.
Right.
What should we do and what shouldn't we do?
Perfect. Ideally, yes, visit a biological dentist, and there is an organization that you can just go in there and find dentists throughout the world, and is the IAOMT, and they have dentists.
IAOMT.com.
Correct. Yes.
Okay, we'll put the link in the notes as well.
Perfect. So there's dentists, biological dentists all over the world now, and they're growing. So what can we do as a patient? Definitely oral hygiene is key. So brushing, we recommend ideally electric toothbrush. My hygienist, she's amazing, and she did a test. And we use this disclosing tablets or the disclosing ink that we put in the patient's mouth. And we can see where the plaque is and what they're missing. And then she made the patients brush with a manual toothbrush. And then she made them brush with the electric toothbrush. And I don't remember exactly how she did this. I think they were doing it at home, but it took multiple hours to remove with the manual toothbrush all that plaque versus with the electrical toothbrush. They have done studies where they show that electrical toothbrush does a better job than a manual toothbrush. So that will be the first recommendation. Flossing every single day. Flossing. One of my favorite flosses is called Coco Floss, COCO floss, Coco, and it has coconut oil in it. According to Ayurveda, the medicine from India, coconut, and they recommend, this is another tip that I recommend, it's
The oil
the
pulling.
oil pulling, exactly. So do it in the morning, do that oil pulling, and then spit in the garbage. Don't spit in the sink because it will clog it.
Oh, yeah, good point.
Yes, so just do that in the morning. And what it's doing is helping your mouth get moisturized. It's antibacterial, and it's just cleaning all these toxins that you had stored overnight. So we have brushing. Electrical toothbrush will be a good idea. Flossing every day. A thicker floss, the thicker the floss, the better. I do not recommend the tape. The thinner the floss, just imagine you're trying to clean a space with a very small floss. You want the biggest, thickest floss to be able to do a better job cleaning. And then the coconut oil. Something else that we recommend and we use a lot in our practice is ozone. Ozone is 3 molecules of oxygen. It has an antibacterial, antiviral effect. It reduces
Anti-inflammatory.
reduces sensitivity. So there's some, and it's very, so it doesn't stay, for example, we use with every patient ozonated water, but it doesn't stay good for long because it expires kind of. And so, but ozonated oil lasts a long time. So patients that have some inflammation, they can put a little bit of ozonated oil in that area, and it helps with the inflammation. So that will be a good tip. And then regarding toothpaste, that's a really amazing topic. What are my recommendations? So using a toothpaste that has nanoparticles of hydroxyapatite. The tooth structure is made with hydroxyapatite. It has hydroxyapatite crystals. So it will help mineralize the tooth structure. And there are several brands that have the hydroxyapatite. For example, one of the ones that I like is Boca, Boka. The flavor is better, is minty. There is another one that is Revitin. And then that's another thing. You use your toothpaste as a medicine. Because if you have inflammation, you have a lot of activity in your sample when they did the sample of your bacteria in your mouth. You want to use something that is going to minimize that bad bacteria and then feed that good bacteria. So there's a specific toothpaste for those patients. If there is sensitivity and you need some mineralization, use the hydroxyapatite. So use your toothpaste depending on what you need.
So I love that there's some other options out there. And then brushing once a day, twice a day after every time you eat, like what's the
So the
recommendation there?
minimum recommended, it's 2 times a day. But let's say you're eating a lot throughout the day, and that's another thing that I miss that is really crucial and is super important for us is nutrition. If the patient is having a lot of sugary foods or drinks, and then remind me about drinks because there's something really important on that. Or a lot of processed foods. We're feeding this bad bacteria, and those type of foods they stick to your teeth more. So if you're just brushing twice a day, but between meals you had this snacking that was full of sugar and processed food and food that's stuck in your teeth, and you're gonna leave, it's gonna be sitting in there for hours. Maybe it's a good idea to add an extra brushing in there and maybe flossing. So talking about this drinks, and this is something that we noticed when the bubbly water started coming up, and it was a trend. This fizzy water, we started noticing that the patients were having a lot more cavities, and people had pretty nice oral hygiene, very minimum plaque, but they started having all this demineralization. And the reason for this is because the majority of all, if not all, to make the fizzy water, they use an acid that makes it fizzy. What happens, it lowers the pH of our saliva, increases the bacteria, it increases decalcification of the tooth structure, so there is easier for bacteria to come and just create damage on the tooth structure. So I warn everybody that are drinking this carbonated waters to maybe just limit it and then just be aware that the more you drink, the more chances you're going to have that the pH is going to be low and more bacteria causing damage on your teeth.
Is the pH lower in the natural occurring bubbly waters like Perrier or San Pellegrino? Oh
I
my.
know, I know.
All right.
Unfortunately,
It's so sad.
I know, I know it is. Some of the things that we recommend people do is measuring the pH of their saliva because it could be coming from the outside, like depending on what you're eating. We want a
Mhm.
pH to be around 7. People can get, patients, we recommend this pH
Just those
first,
little sticks.
the little strips, yes. And then around 7 is a good pH. If it's below that, then that's more acidic and we don't want that. But then the acidity is coming either from the external environment with what you're eating, or it could be coming from the inside of. So if there is an imbalance in your body, then your pH is
Right.
going to be low. So testing the pH in the morning and maybe before going to bed, that will give you an idea, and you can start biohacking your body and just getting that data that we need to be able to see, okay, what's happening with my body? Why is it reacting this way?
Oh my gosh, so many amazing pearls. Thank you so, so much for sharing your immense knowledge with how our mouth and our teeth affect our whole body. Well, thank you so, so, so much, Dr. Perez. You are a joy, a wealth of knowledge. Thank you for sharing your brilliance with
Yes, my
us.
pleasure.
Thank you, everybody, for helping us spread the word. Share this podcast with those that you love. Remember, health can be contagious. And then make sure to subscribe so we're right there for you when the next news comes along. Thank you. Have a beautiful day.